NG tube is a flexible plastic tube that goes in through the patient's nose, down the nasopharynx, through the esophagus, and into the stomach. NG tubes are used for two main purposes. One purpose is for taking content out of the stomach, and the other for administering medications or nutrition into the stomach for patients that cannot receive it orally. They're used in situations where the intestines need to rest, for example, bowel obstructions. In this video, we're going to show you how to properly administer medications through an NG tube. Step 1. The first step is gathering supplies. You will need gloves, water, does not have to be sterile, a stethoscope, medication cups, medications, a 60 milliliter syringe. Step 2. Follow all protocols of patient safety, including 3 checks and 5 wipes. Perform proper hand hygiene. Step 3. Preparing the medications. For pills, use a pill crusher. Crush each pill one at a time. Dissolve the powder with water or other recommended liquids, keeping each medication separate from the others. For liquids, be sure to read the amount of medication at the bottom of the meniscus at eye level. Step 4. Assist patient to high Fowler's position. Ask them to state their name and date of birth.
Can you tell me your name and date of birth?
Yes, my name is Fergie Johnson, and I was born on April 24th, 1970.
Okay, thank you, Fergie.
Inform the patient of the medications they will be receiving and ask if they have any questions or concerns.
Today I'm going to be giving you your Tylenol, Ativan, and Simvastatin. Do you have any questions about them?
No, I take those all the time.
Okay, thanks.
Step 5. The next step to administering medications is to check for tube placement. Placement is verified most accurately by using multiple methods. One method is to check the mark made on the tubing.
Okay, I'm going to check the mark that are in your tubing here.
When NG tubes are inserted, a mark is made by the nostril once placement is confirmed by X-ray. This provides a way to see if the tube has moved. Another method is to aspirate the stomach contents and check the pH. It should be less than 5.5. The definitive way to confirm placement is by X-ray. One other method that is commonly used, called the whooshing method, a stethoscope is placed over the stomach area. A small amount of air is injected through the tube, and a whooshing sound is heard. Step 6. Before administering medications, it is important to flush the tubing to ensure patency. The steps to doing this are: connect the syringe to the tubing, clamp the NG tube, remove the plunger from the 60 milliliter syringe, pour 60 milliliters of water into the syringe, Unclamp the tube and allow the water to enter the stomach via gravity infusion. Step 7. After flushing, medications are ready to be administered. Administer the first dose of medication by pouring it into the syringe. Follow this with a 5 to 15 milliliter flush of water. Continue administering medications one at a time while flushing in between each dose. Follow the last dose of medication with a 60 milliliter water flush. First, reclamp the tube. Pour 60 milliliters of water into the syringe. Unclamp the tube and allow the water to enter the stomach. This ensures that medication is not left in the tubing. The most important things to remember about NG tube medication administration are: A. To check for tube placement to ensure that the meds will be reaching the stomach. B. Flush before medication administration to make sure the tube is patent. And C. Flush after med administration to make sure that no medication is left in the tubing. It is important to keep track of the amount of fluid used during this process for intake and output purposes as well.